Hello and welcome to Mental Health Matters. I'm Edgar Wiggins, your host for this program that is dedicated to providing you practical and useful information regarding mental health issues and needs. Psychiatry. What is it? What's a psychiatrist? Here to help us understand this very important subject is Dr. Mark Komrad. Dr. Komrad is a psychiatrist on the clinical and teaching staff of Sheppard Pratt Hospital and the Johns Hopkins Hospital in Baltimore. He is also a clinical assistant professor of psychiatry at the University of Maryland. And finally, Dr. Komrad is on the board of the Maryland Foundation for Psychiatry. Good morning and welcome to Mental Health Matters, Dr. Komrad.
Thank you so much for inviting me, Edgar.
Let's start out by talking about what a psychiatrist is. What is a psychiatrist and what is the field of psychiatry? What are we talking about here?
A very good question, because remarkably, although people hear this word often, they often don't know exactly what is a psychiatrist, and particularly what distinguishes us from other mental health professionals. Really, the easiest way to answer that question is to remind folks that a psychiatrist is a physician. A psychiatrist has gone to medical school like any other doctor and has specialized in problems of mental life. We have a special residency training, just like surgeons have their residency and pediatricians have their residency after medical school. We have our residency of 4 years in which we learn to master the problems, the ways in which things can go wrong in people's mental lives. Sometimes we even go on after that to even develop subspecialty interests like child psychiatry or geriatric psychiatry. So we are fully trained physicians, and as such we can do anything any doctor can do. We have some special things that we do that other physicians don't do. For example, spending lots of time sometimes having meetings with patients where we just talk, but in addition, unlike other mental health professionals who also can just talk, we can also provide other treatments such as medications, and even if necessary, treat people in an inpatient setting in a hospital and use some other special techniques. Perhaps we can get into some of those. But at the end of the day, we're just physicians, MDs, like your family doctor.
So what might be some of the advantages of seeing, say, a psychiatrist versus seeing a psychologist? Because my understanding is that, of course, psychologists do talk therapy or psychotherapy or counseling. But what might be an advantage of seeing a psychiatrist?
Well, one of the things that we learn is that problems in mental life can occur from a large variety of different causes. We generally divide those causes into sort of 4 areas. Some problems in mental life can best be understood as diseases, such as diabetes, for example, is a disease. There are certain mental conditions that could be understood as diseases, such as schizophrenia, for example, or bipolar disorder, manic depression, or even some kinds of depression. Other problems in mental life are due to how we vary as human beings along different dimensions, like some people are taller and some people are shorter. Same thing with the way we're made up. Some people have higher intelligence, some people lower intelligence, some people are more vulnerable or less vulnerable. Some problems are understood like that, for example, personality disorders. Some problems are due to learning and how in the course of our life we've learned to do things and been reinforced, or we've seen from our examples in society or are influenced to behave in certain ways. Some problems are best understood like that, for example, eating disorders or addictions. And then finally, there are problems that go wrong in people's mental lives due to the stories of our lives, how we were raised and what happened to us. So for example, let's say we were raised in an abusive family in which trust was difficult. We can understand how that story might lead, for example, to problems making commitments in relationships when we're more mature in adult life. So that's another domain of problems. Why do I mention these 4 domains? Because psychiatrists are really experts at trying to answer the question, what's going on here? And we are trained in all 4 domains: disease, dimensions, behaviors, and life stories, in order to make a comprehensive evaluation. And once making that comprehensive evaluation of all 4 areas, we are also in the position to treat any of those 4 areas. And then finally, it's important to say that there are some problems in mental life that seem to be due to other diseases. For example, a brain tumor, or a thyroid imbalance, or even certain kinds of cancer or AIDS can cause disruptions in the areas of thoughts, feelings, and behaviors, which is what we mean when we say mental life. And as physicians, we psychiatrists are in a good position to try to make sure we're not dealing with another disease, perhaps a disease that even hasn't even been diagnosed yet, like a thyroid problem, or a brain tumor, or another kind of problem, which, based on our medical training, we're in a position to try to flesh out. So that kind of comprehensive, total view of all the different ways of thinking about what could be going on here, that really is the expertise of a psychiatrist, and that is something that we are trained to do more comprehensively, and we also are empowered to provide a wider variety of interventions based on that, the answer to what's going on here, than any other mental health professionals such as psychologists or social workers.
Well, what about some of the interventions? What might a psychiatrist do?
Well, let's think about these 4 areas that I mentioned. For example, those things that we think may be due to a medical illness, we may be in a position to order laboratory tests or possibly refer to another specialist once we've been able to clarify that that's the problem. Other things that may be due to chemical imbalances in the brain, also we understand as diseases. We have a wide variety now of state-of-the-art medications that are available to treat those things, and we as psychiatrists can personally provide prescriptions, and we are experts in those kinds of medicines. Some family physicians deal with certain kinds of medicines, like antidepressants, but it's something they do occasionally. We are experts in those medications, so going to see a psychiatrist instead of your family doctor for that is kind of like if you had a heart condition. You'd probably want to see a cardiologist who is an expert in those kinds of problems and the medications used for them, and have the support and the background of your family physician. So medicines is something that we can do a lot of. I do want to say that people commonly believe, because we are the only mental health professionals who can prescribe medicine, they sometimes mistakenly believe that's all we do, that we just prescribe medicine. And I want to just make it clear that we also talk to patients.
Well, one of the other things that often comes up is the whole issue of managed care. And their job, which is, among other things, to contain cost. And when we look at mental health professionals, one of the things that we know is that when you see a psychiatrist, that is the most expensive treatment. I often believe, and this is my small editorial comment, that often patients are getting shortchanged. Sometimes people just see psychiatrists for a consultation around medications, but I think it's really important, your message about the fact that psychiatrists really are experts and do see the patient as a total human being.
Right. And yes, managed care has tended to push us more into the role of being the diagnostician, the one who answers the question, as I said before, what's going on here? And then sometimes asks us, well, if it's just talk the person needs in order to overcome their problems, to refer them on to a psychologist or a social worker. But oftentimes we can just as easily do that talk therapy ourselves. Sometimes it's even, particularly with more complicated cases, much more efficient and much more effective to combine the medication treatment and the talk therapy in one and the same place, something that I affectionately call one-stop shopping.
Sure.
And psychiatrists can offer that kind of one-stop shopping, which is especially good for more complicated cases. But even for simpler cases, sometimes being able to combine the two really doubles the power of healing, so that you actually end up getting a more efficient treatment, so people can actually get better quickly. And perhaps not surprisingly, because of that increased efficiency in one-stop shopping, you actually end up spending less money on the mental health treatment in the long run than if you split it up.
Let's just kind of change direction a little bit, because certainly we have those issues, but I think there also are some common misperceptions about psychiatrists, what they do. Often we see roles perhaps in TV, in movies, in Hollywood. There are these kinds of ideas that psychiatrists are not really mental health professionals, but some kinds of often strange people. I mean, there are lots of things, Hannibal Lecter and some of the other characterizations.
And Silence of the Lambs.
Sure, sure. Can you just comment on that? How accurate are the portrayals of psychiatrists that we typically see?
Well, you know, it depends on how far back you go or how recent you are. Hollywood tends to mirror what's going on in society in general. So back in the golden age of Hollywood, in the 50s and the 60s, the era of Alfred Hitchcock, for example, psychiatrists were often depicted as the wise people, almost like detectives who would go in and unravel all the mysteries, and often at the end of the movies would come out, like in the movie Psycho, will come out at the end and explain it all and explain what's going on. Well, in more contemporary times, as you mentioned managed care, for example, beginning to change and put pressure on psychiatrists to just do the diagnosis or just give medicine, Hollywood has also changed our depiction. And now what very often Hollywood has done with that is shown us to be not just the medication guys, but often the evil medication guys with these sharp, pointy needles, you know, who, and also taking from the fact that we can use the hospital, and sometimes if patients are dangerous, we can even put people in the hospital with legal due process against their will for a while until they get better. Hollywood loves that one too, and exaggerates us as prison guards and people who deprive everyone of their civil rights, often at the pointy end of the syringe, and show us sometimes to be scary, very powerful, and monstrous, such as in Silence of the Lambs. Alternatively,
hold that thought, because this is something that we want to get into some more, but we need to take a break, and we'll be right back.
Did you know you can help keep Maryland safe? I'm Colonel Terrence B. Sheridan, Superintendent of the Maryland State Police. In cooperation with local, state, and federal law enforcement partners, we are working hard to identify and prevent acts of terrorism in Maryland before they occur. We need your help. Trust your instincts. If you see someone or something unusual that could be related to terrorism, pick up the phone and call. You can reach us around the clock at our Terrorism Tip Center at 1-800-492-TIPS. That's 1-800-492-TIPS. Don't hesitate, give us a call. Together, we can make Maryland's homeland secure.
Bachelor number 1, how would you advise me to structure my investment portfolio?
I would say be cautious and invest in government bonds, money markets, and CD accounts.
Bachelor number 2,
I'd say at your age to invest fully in high-yield stock.
and bachelor number 3.
I'd diversify your investments. It would make your overall portfolio more balanced and can minimize your risk.
Okay, there you go. Now it's time for you to make a date.
Bachelor number 3.
Bachelor number 3.
Remember, make a date today to diversify your portfolio and choose to save.
Welcome back to Mental Health Matters. We're joined today by Dr. Mark Komrad. Dr. Komrad is a psychiatrist on the clinical teaching staff of Shepherd Pratt Hospital and Johns Hopkins Hospital. He also is a board member of the Maryland Foundation for Psychiatry. Now, before the break, Dr. Komrad, we were talking about how psychiatrists are often depicted in the media. But one of the other things I think is important to mention before we get back on that topic is to talk a little bit about the Maryland Foundation for Psychiatry, who they are and what they do.
The Maryland Foundation for Psychiatry really does exactly what we're doing here today.
Okay.
It's a nonprofit organization that tries to explain who psychiatrists are, what we do, what are the state-of-the-art treatments for mental disorders, and to try and help people see that mental disorders are really not that much different from any other medical disorder, and therefore we shouldn't necessarily as a society have special negative attitudes, the very kind of attitudes that we said, you know, Hollywood helps to promote, and that creates what we call stigma, which are prejudice against people with mental illness, interestingly, and those who treat them. And one of our missions is to combat stigma in the act of educating the public about a correct understanding of both mental illness and its treatments.
Well, before we get further into that, one of the things that especially concerns me about stigma is one of the things that is a barrier to people receiving the proper care for their mental illness.
Absolutely critical, because when we say we combat stigma, that's not just in order to make people who are already in treatment comfortable. You're quite right in saying that the most important thing about combating stigma is to help people overcome their embarrassment to get help, because it is often stigma that causes people to be reluctant to seek help, afraid of what other people are going to think of them, by virtue of being in mental health treatment, which is in many ways, you know, a catch-22. It causes them to avoid the very thing they need because of their own prejudices. So that is something that the Maryland Foundation for Psychiatry is very, very devoted to trying to lift.
Well, the other thing about stigma is to the degree and extent that people don't seek treatment because of misinformation, it really compounds their suffering.
Right, that illnesses get worse. Problems that can be interrupted or reversed progress. And then what happens is you have twofold problem. One is the actual condition that you're suffering from and the embarrassment of that. It gives meaning to that old phrase, adding insult to injury.
Okay. Well, let's get back to some of the ways in which psychiatrists are portrayed in the media and really not represented accurately.
Well, we talked before about the monstrous depictions, such as Silence of the Lambs. Then there's a whole other set of depictions, which are the psychiatrists as clowns or buffoons or as idiots. I'm thinking of a movie like What About Bob, where Richard Dreyfuss plays a psychiatrist that is increasingly made fun of by his patient Bill Murray, and at the end of the film, as many of these kinds of depictions, the psychiatrist is the one who ends up in the hospital, while the patient ends up, you know, being the so-called healthy one. And as you and I were talking earlier, it's interesting that psychiatrists seem to be the only kind of physicians who become distorted in this way by the media. Why should we care? Not because I, as a psychiatrist, am insulted, but precisely because of the issue of stigma. The stigma is not just about mental illness, but it's also about the people who treat it. So if you think that you're going to get treatment from either a monster or an idiot, how much more reluctant are you to show up? People don't come armed with those prejudices about, say, a cardiologist from the media like they might from a psychiatrist. We're just these guys. We're just these docs. And, you know, we are on the patient side. We're trying to do the right thing. We're very well trained. We have incredibly effective treatment at our disposal. What a lot of people don't realize, for example, the statistics of treating psychiatric disorders. Do you know that we are better at treating mental illness than other doctors are at preventing strokes or heart attacks? That we're better at reversing the course of serious psychological suffering than the statistics are for reversing the course of cancer? And yet, if you have a cancer, you've got about 90% chance of showing up for treatment for it. If you have a mental illness, you only have about a 10% chance of showing up for treatment for it, often because of stigma, often because of people waiting way to the last minute.
Well, it's also interesting because according to the National Alliance for the Mentally Ill, 1 in 5 families are going to be affected by a mental illness.
Right.
So we're not talking about, you know, a handful of people. We're really talking about illnesses and problems that affect a number of Americans across all socioeconomic lines, all racial and ethnic and cultural lines. So this is something that's extremely important to educate people about.
Right, and also, one of the things that I would say, everybody is always so interested in preventative medicine, you know, preventing problems. It turns out that psychiatry probably has the most effective ability to prevent either problems from beginning or from problems from getting worse. If you can make early interventions, particularly for children and adolescents or young adults, the sooner you can get in there and make an intervention, you can change the entire course of a person's life. We are very, very effective preventative medicine docs.
That's really fascinating, and I'm sitting here thinking about all of the ways in which our language in this country, I was thinking about the Wayne's World movie when one of the characters said to a woman, "Are you mental?" You know, we call people crazy. There's the whole thing about being retarded, all of the ways in which stigma is associated with mental illnesses, and we don't see them like cancer, like, you know, coronary artery problems, like a lot of the other diseases that people are not at all reluctant to seek help for.
Well, you know, the way I've come to understand this over the years, why are we more vulnerable to this? It's because mental life is the most dear and precious thing to human beings. It is one of the things that most make us human. Tell you the truth, it's one of the reasons I became a psychiatrist, is because of all the areas of medicine. I was interested in that area that involves the core essence of what it means to be a human being. And for that reason, when something goes wrong in that area, it can be among the most frightening things to happen. And I think that the fear that's associated with that largely accounts for some of our complex and mixed feelings about mental disorders.
That makes a lot of sense. The other thing that also strikes me is that there are a number of kind of competing interests, because when you think about religion and spirituality, especially in certain communities, that's one of the ways in which people try to resolve whatever their mental and emotional issues are. You know, being African American, I recognize that often people, that's one of the reasons that the African American community is so much involved in spirituality and the faith community. And at times I see people struggling with those two things. Well, if I pray about it, it'll be okay. Yes. And I'm well known for saying, well, you know, you can pray about it, but also go get some help as well.
Right, right. You know, all throughout history, we've evolved all of these institutions to take care of us as human beings, our essential humanity. And I like to think all of those institutions, you know, are working together to make a comprehensive whole. We psychiatrists very often partner with spiritual and religious leaders who understand that we all have a piece of the truth, and they can refer to us for our expertise, and it's not unusual for us to recommend to our patients that they also should get some spiritual consultation or spiritual dimension to their lives, sometimes even going to consult their spiritual director as part of their healing process, because we all are working hand in hand. We all together make up the whole perspective on what it means to be a human being.
Well, in the couple of minutes that we have left, let's talk a little bit more specifically about what the Maryland Foundation for Psychiatry does in terms of trying to educate the public about psychiatry.
Well, we have a wonderful website, which is Psych Foundation. mdpsychfoundation.org, which has a number of really interesting articles about psychiatry, about movies that depict psychiatry or mental illness, about articles that appear in the news. So that's one way that we serve the public. Another way is we sponsor programs in which we bring in often people who are musicians or artists. Sometimes we give lectures in conjunction with a movie that's just released or a play down at the Hippodrome. We also give awards to various organizations that are helping the public understand or give treatment to people with mental illness. And we have a variety of awards that we give out. We're a nonprofit organization, and we are here to empower both people who are suffering and to empower those professionals and organizations who are helping them. Some of whom are psychiatrists, but many of whom, like the Baltimore Crisis Response Center, are organizations much broader than psychiatrists that are. We're all serving the same cause, and we're a clearinghouse that brings together information and empowerment for all of those that are pulling together for the mentally ill.
Well, Dr. Komrad, I want to thank you for the important work that you do. Thank you for coming in today. There's lots that needs to be done to give people the correct and proper and accurate information about psychiatrists, psychiatry, and mental illnesses. So thank you.
Thank you.
And I want to thank you, viewing audience. And remember, if you or someone that you know needs help with a mental health crisis, you can call Baltimore Crisis Response 24 hours a day at 410-752-2272. And remember, your mental health matters to us. Thank you.